Welcome back to the Deep Dive. Today, we're going to be looking at something I think we all think about a lot as eye care professionals,
Yeah.
and that is adherence to diabetic retinopathy screening. It's
Mhm.
obviously such a crucial part of managing diabetes and preventing vision loss,
Mhm.
but, the big question is, are we doing enough to make sure our patients are getting screened regularly? Are we doing everything we can?
It's a really good question, and it's one that a recent meta-analysis in the American Journal of Ophthalmology really tried to tackle.
Okay.
We'll link that study in the description, of course, but
Absolutely.
we're going to break it down for you right here, right now, so you don't have to go through all the jargon yourself.
I love it.
Yeah.
So this study was huge. It looked at data from over 11 million participants
Wow.
across 28 countries.
That's a lot of people.
That is a global perspective.
Yeah, it really does give us a good idea of what's happening worldwide.
Okay.
And one of the biggest things that stood out to me is that global adherence to DR screening is only about 63%.
Which means over a third of people with diabetes aren't getting their eyes checked.
Yeah, that is a really
That's a real-
sobering statistic, especially considering the potential consequences if you don't treat DR.
Absolutely. And even more alarming is the gap between high-income countries and then low- and middle-income countries.
Okay.
Adherence in those high-income countries is almost twice as high as in low- and middle-income countries.
So location plays a big role in whether or not someone is getting screened for DR.
Unfortunately, it does.
Is it playing out in a predictable way geographically?
Yeah, it is. The lowest rates are in Africa and Asia, and Europe had the highest adherence rates,
Interesting.
which contributes to the uneven prevalence of DR-related blindness around the world.
Yeah.
Really highlights how important access to healthcare and resources is
It really does,
to these
for
patients.
sure.
Yeah.
So we're seeing a global issue with lower adherence in LMICs. But I kind of want to zoom in a little bit here.
Did the study find anything surprising about who is and isn't getting screened regardless of location?
Yeah.
We often have assumptions about certain demographics.
Right.
And I'm curious if the research kind of challenged any of those assumptions that we have.
Yeah, it definitely did. One of the most unexpected findings was related to age.
Interesting.
We usually think that younger patients would be a little bit more proactive about their health,
For sure. Yeah, you would think they'd be all about,
maybe more concerned about how they look and maintaining their vision.
yeah, those high selfies, right?
Right. But what the study found is that younger adults, 18 to 39,
Okay.
were actually less likely to adhere to screening than older age groups.
That's fascinating. It seems counterintuitive.
Yeah.
Why do you think that is?
It's probably a lot of different things.
Fuck.
Younger adults might feel like they're not as vulnerable to diabetes complications. Maybe they haven't personally seen the effects of untreated DR, or they just haven't connected their current health to their future vision.
It's like they have time on their side, so they're not really thinking about preventative care.
Exactly. It's that classic
Yeah.
out of sight, out of mind.
Okay, yeah.
Unfortunately, with DR, by the time you notice vision problems, it might be too late to reverse the damage.
That's a really good point.
Yeah.
So age is one factor.
Yeah.
What else did they find about the people who are more or less likely to get screened?
Education level was another thing that was really important.
Okay.
People with college education or higher were more likely to get screened.
So knowledge is power when it comes to DR.
Yeah, it definitely plays a role.
Okay.
Higher education could lead to better health literacy and a deeper understanding of DR and its complications.
Makes sense.
It could also help them, advocate for themselves in the healthcare system and make good decisions about their health.
Yeah, for sure. Were there any other demographic factors that stood out?
Being married, living in an urban area, having higher family income, and having health insurance were all linked to better adherence.
So basically the usual suspects when we're talking about health disparities. It's not surprising, but it's disheartening.
Yeah.
These findings really show how much socioeconomic factors impact access to care.
Absolutely.
Yeah.
It's a good reminder that for some people, getting screened isn't as easy as just scheduling an appointment.
Right.
It's a lot more complicated than that.
For sure. There
Yeah.
could be transportation or childcare issues or
Yeah.
financial constraints
Exactly.
or lack of insurance.
Yeah,
It's a good reminder that we need to think about these challenges when we're talking to our patients.
for sure. We need to go beyond just telling patients to get screened.
Yeah.
We need to understand their situation and help them find ways to overcome these obstacles.
Yeah. Okay. So we've got age, education, and socioeconomic factors
Mm-hmm.
all playing a role. What about clinical factors?
Okay.
Did the study shed any light on how a patient's medical history might influence their adherence to screening?
Yeah, it did. They found that people with a longer duration of diabetes, especially type 2, and those with a family history of diabetes were more likely to get screened.
That makes sense. If you've been living with diabetes for a while or seen it impact your family, you're probably more aware of the complications
Yeah.
and the importance of proactive care.
They've seen what can happen if diabetes isn't managed.
Exactly.
They're more in tune to those risks
Yeah.
and more motivated to protect their health.
Yeah. Experience is a powerful teacher,
Mm-hmm.
even if it's someone else's experience that you're seeing.
Right.
Did the researchers find anything else about the patients themselves that seemed to link with getting screened more often?
Patients with existing vision impairment or a history of eye diseases were more likely to adhere to screening.
Yeah, if you've already had problems with your eyes,
Mm-hmm.
you're probably more likely to get them checked.
Right.
It's a wake-up call.
Exactly. They've experienced vision loss, so they want to protect what they have left.
Right, so they're playing defense trying to protect their eyesight.
Exactly.
Interesting. So we've got those who have experienced eye issues before, more likely to get screened.
Mm-hmm.
What about treatments?
Okay.
Did the study look at whether certain treatment types were linked to screening adherence?
They found that patients on insulin treatment were also more likely to get screened.
Okay, that makes sense. Insulin is usually prescribed for more advanced diabetes.
Yeah.
So those patients are probably interacting with their doctors more often, and they're getting more education about eye care.
Exactly. They're more connected to the healthcare system, so they have better access to information and resources.
Okay.
And managing diabetes with insulin requires a lot of work, so these patients are already thinking about how to manage their health.
Yeah, okay, so we see that age education, socioeconomic factors, duration of diabetes, family history,
Right.
existing vision problems, and even treatment type can all play a role in whether or not someone gets screened for DR.
Mm-hmm.
Are you ready to give me another curveball from the study?
I think so. This one might surprise you. The study found a link between good mental health and better adherence to screening.
Wow. I wouldn't have thought to connect those two things.
Yeah.
But when you think about it, managing a chronic condition like diabetes can be really stressful.
Absolutely.
And stress can definitely make it harder for someone to focus on their health.
Exactly. It's a reminder that we're treating a whole person,
Yeah,
not just their eyes.
it's all connected.
Yeah.
This study is really showing us how many different factors can influence someone's healthcare decisions.
Mm-hmm.
But before we go too far into analyzing those connections, I want to take a step back and talk about how the researchers got these findings.
Okay.
What did their methods look like?
They were pretty thorough. They looked at 77 different studies and 2 national websites.
Wow, that is a deep dive.
They mainly focused on cohort and cross-sectional studies, which are great for seeing trends and associations in big populations.
So lots of data to give us a broad picture.
Yeah, and their main goal was to figure out that global DR screening adherence rate we've been talking about. But they also wanted to see how all those different things we talked about were related to adherence.
So were they just looking at the data, or did they use any fancy statistical methods?
They used some pretty advanced statistics. They used something called random effects models to combine the data from all those studies and take into account all the different ways the studies were done.
I'm getting flashbacks to stats class.
You don't have to worry. We won't go into too much detail.
Okay, good.
But these models are designed to give us the most accurate estimates, even with a ton of data.
Got it. So they analyzed all that data, got some interesting relationships, and now here we are trying to understand what it all means.
Yeah, and we'll talk more about what these findings mean in just a bit. But first, we got to give our brains a quick break.
Sounds good to me. We'll be right back after a word from our sponsors.
And we're back. Before the break, we were talking about the really interesting findings from that meta-analysis on diabetic retinopathy screening adherence.
Yeah, there are definitely a lot of different factors at play here. And some of them were pretty unexpected, I thought.
Yeah.
But now we have to figure out what all of this means for us as eye care professionals.
Right.
You know, how can we use this information to improve adherence and help our patients protect their vision?
Yeah. It's not enough to just know about these trends.
Right.
We have to do something about it.
Okay. So let's brainstorm some strategies.
Okay.
Let's start with those younger patients who the study said aren't getting screened as often as they should be.
Okay.
I'm having trouble imagining how to get a 25-year-old who feels invincible
Right.
to understand how important DR screening is. What are your thoughts on that?
Yeah, that's the big question, isn't it?
Yeah.
We have to make DR real and relevant to them.
Right.
We need to connect how risky it really is to their actual lives.
So instead of just giving them a lecture about complications that could happen way down the road,
Right.
we need to connect eye health to what's going on in their lives right now.
Exactly. We can talk about things they care about, like travel or hobbies,
Mhm.
their careers, their relationships. We can help them see that good vision is important for everything they want to do in life.
So we're showing them that taking care of their eyes now
Mm.
is an investment in their future.
Mm. Mm.
I love that approach. Okay, what about those patients who can't afford screening?
Okay.
What can we do to make it more accessible for them?
That's a huge issue. And, the study really highlighted those differences.
Yeah, for sure.
We can't ignore that things like cost and lack of insurance and transportation issues are real problems for a lot of people.
So how do we even go to hair the playing field for them?
First, we need to know what resources are out there
Okay.
and be ready to connect our patients with those resources,
Yep.
like transportation programs, free or low-cost clinics, or help signing up for vision insurance.
So we're being advocates for our patients,
Mm.
not just their eye doctors.
Exactly. We have to be proactive.
Yeah.
We can also think about partnering with other organizations in the community like churches or social service agencies to offer screenings in places that are easy for people to get to.
I love that, like a mobile eye clinic that goes to different neighborhoods.
Yeah,
We could bring the screening to them
exactly.
rather than expecting them to come to us.
Mm-hmm.
And we can't forget about technology. Telemedicine could really change how we deliver care,
Oh, for sure.
especially for people in rural areas or places where there aren't a lot of eye doctors.
Yeah.
We could use telemedicine for remote screenings or consultations,
Mm.
even follow-up appointments. You could be a game changer for those who have trouble getting around or can't take time off work.
Absolutely. We should use these new tools to improve our practices.
And while we're talking about technology, we should also think about good old-fashioned patient education materials.
Oh, yeah.
You mean like pamphlets that explain DR in a way that's easy to understand?
Yeah. But we need to go beyond the pamphlet.
Okay.
We need to be creative.
Okay.
We could make videos or infographics or even online tools.
We need to connect with patients where they are.
Mm.
And these days, that's usually online. What about a TikTok series about eye health?
Now you're talking. If we can make learning about eye care fun, then they'll pay attention.
Okay, so we've got a bunch of different ideas here.
Mm-hmm.
Connecting eye health to their lives, addressing those financial barriers,
Right.
embracing technology, and getting creative with patient education.
Yeah.
But what about that connection between mental health and adherence?
Okay.
How do we bring that into our care?
That's a great question, and it's one we need to ask ourselves more. We need to remember that a lot of our patients with diabetes are dealing with anxiety, depression, or other mental health issues.
Of course.
And that can make it even harder to take care of their physical health.
So it's not enough to just remind them to get their eyes checked.
Right.
We have to make them feel comfortable talking about their mental health, too.
Exactly. We need to really listen to them
Yeah.
and let them know that your feelings are valid. We can also help them find mental health resources or just encourage them.
Sometimes just knowing that their doctor understands and cares can make a big difference.
Absolutely. It's about building trust, and that takes time.
Yeah.
But it's so important to providing good care.
And let's not forget about working together.
Yes.
You mean with other healthcare professionals?
Yeah, we need to break down those walls between eye care providers,
Okay.
primary care doctors, endocrinologists, and mental health professionals.
Wow.
When we talk to each other and coordinate care, it helps everyone.
It's like we're all on the same team with the same goal,
Exactly.
helping our patients live healthier, happier lives.
Mm-hmm. And this meta-analysis gives us a guide for how to do that better when it comes to DR screening.
It's like a cheat sheet for better patient care.
Yeah.
And the best part is we can all do something to help, whether it's advocating for policy changes or volunteering at a clinic or just having those tough conversations with our patients. Every little bit counts.
Absolutely. We can all do something to improve adherence and stop vision loss. The more we learn and work together, the better we'll get at this.
I'm feeling inspired to put all of this into practice.
Me too. I know our listeners are excited to hear more about the study's findings, so let's get back to that.
Okay, so we're back, and I think it's time to kind of wrap up our deep dive into DR screening adherence.
That's good.
We talked about all those factors that can influence whether or not someone gets screened.
Right?
And now I think it's time to talk about what we can actually do about it.
Mm.
How can we as eye care professionals take what we've learned from this study and use it to help our patients.
Yeah, it's important to remember that we're not just treating eyes. We're treating people.
Right.
Each person is different.
For sure.
And they all have their own unique situation.
It's like those personalized book recommendations you get from a good librarian.
Yeah.
We need to figure out what each patient needs and tailor our approach to that.
That's a great analogy. And this study gives us some clues about what those needs might be. We talked about those younger patients who often feel invincible.
Yeah.
How can we make DR and the need for screening more real for them?
We need to stop with the scary lectures and find a way to connect eye health to their lives today. Maybe we can talk about things they care about, like their careers, relationships, or even their hobbies.
Right. If they're a photographer, we can talk about how DR could affect their ability to take pictures.
Right.
Or if they love video games, we can talk about how important vision is for gaming.
Yeah, we need to show them that good vision is important for everything they want to do.
Exactly.
So we're showing them that taking care of their eyes now is an investment in their future.
Right.
What about those patients who can't afford screening? We can't just tell them to go get screened if they don't have the money for it.
Absolutely. We need to understand their situation and help them find solutions.
Yeah.
Do they know about programs that can help pay for screening or clinics that offer lower prices? Have we talked about payment plans?
Yeah.
We don't want cost to be the reason someone doesn't get the care they need.
We need to make sure they have the information they need so they can get the care they need. We can also advocate for changes that would make screening more affordable for everyone.
Exactly. It's not enough to just focus on individuals.
Right.
We need to think about the bigger picture and work towards solutions that benefit everyone.
Well said. This study has really shown me how many different things can influence someone's decision to get screened for DR. It's complicated and there's no easy answer.
Yeah, but the good news is that we now understand the challenges better.
Right.
And if we work together, we can make a real difference.
Okay, so to wrap things up, what's the one thing you want our listeners to remember from today's episode?
I think the most important thing is to be proactive and focus on the patient.
Okay.
We need to do more than just offer screening.
Okay.
We need to talk to our patients.
Yeah.
Understand what they need and help them take control of their own eye health.
That's a great point. Well, we hope this deep dive has been helpful for everyone listening out there.
Yeah.
Don't forget to check out the link to the full study in the show notes. And if you found this episode helpful, please leave us a 5-star rating. It really helps us reach more eye care professionals like you.
And be sure to follow the show for more deep dives into interesting research.
Thanks for joining us, and we'll see you next time on The Deep Dive.